Surging cases of malaria disease has left a section of concerned residents worried in Busia district. It is reported that the patients currently who are subjected to rapid diagnostic test, 85% tests positive to malaria virus in most of health facilities in the area. The alarming situation has attracted Massaf Crust Foundation Ministry in partnership with East African Children Project to donate the treated mosquito nets in Massaf General Hospital, Bumunji Health Center 3 and Sibona Health Center 2. In interview with some patients at Massaf General Hospital says that there is a challenge that patients' beds lacks mosquito nets, making the facility prone to the spread of malaria. The medics who heads the maternity ward, children's ward and antenatal care section in Massaf General Hospital, when receiving the mosquito nets, says that they initially had the bed nets but got old, one off that prompted them to remove.
So, we thank you for the provision of nets, but then we are now lacking the hangers where we are putting the nets. We still need your help where necessary.
I say that the situation is not good at all in our area, because as we receive our mothers of antenatal, at first antenatal we do several tests for them, and one of the tests that we carry out is a malaria rapid diagnostic test. So as we test these mothers, we realize that a number of them turn out to be malaria positive, though they come without even any signs. But as we test them, we find they are having malaria. The donation that you've done to us is going to be of benefit to the facility and the sub-county at large. Reason being is that with the side of maternity and as Masinye sub-county, as you see it, we have a challenge where we have malaria cases being at a high rate. For example, I'll give is like the mothers who come for antenatal. You find that out of 90 or 100% of the ones that we screen and we do the RDT testing and RBS, and we also do the BS, you find that those who react to malaria, we have like 85% out of 100. So implying that we have a high rate of malaria cases in Masinya sub-county. So as you've given us a donation of the mosquito nets, they will help us to at least reduce on the numbers of malaria cases that we are going to be getting as a facility and maternity at large.
Very grateful today. I will receive the mosquito nets for our patients. They have been lacking mosquito nets, and most of them have been going home with malaria. It is time them when their wounds are okay, they come back with the malaria. So today I'm very grateful. Our mothers have received the mosquito nets, and we are going to use them effectively starting from today onwards. We are going to manage these mosquito nets after a patient using them. An attendant will be washing, dry it properly, brings it back before we discharge him or her home.
Nasirumbikana, the social health worker attached to Massaf General Hospital, on behalf of the hospital in charge, says that they are currently facing the challenge of mosquito net stock out in the facility. They have taken 2 quarters without receiving mosquito nets. The donation by the well-wishers has come timely.
Malaria has been so rampant that every person who is tested for malaria is most likely to get a positive results. So we have so many cases from the community. They come with malaria, and even within the hospital we tend to get malaria, because we have breeding spaces like stagnant water, we have bushes around us, so we have so much infection of malaria in the community and at the hospital.
Hilary Owundo, the director, Massa for Grass Foundation, says that they have donated following the findings in the research they conducted and realized that there is high cases of malaria. He applauded their donors for considering their request due to the alarming situation in the area.
We have a lot of activities that we do, but this charity has helped us so much in very many issues. We have looked at the challenge more so maternity. Those guys, in fact, the health workers in maternity, their one major appeal was in terms of the laundry machine, which can help them towards this blood. More so people from the theater, from operation, and this delivering mother, you find that a casual worker just washes just blood stain with the hands. And we pray that in the future, if God provides, at least we can sacrifice and we offer that department with a laundry machine which can help them in washing things. And finally, I want really to appreciate all the leaders of the community. I want to appreciate the media house which has covered this occasion, and mostly I want to appreciate all the donors, the funders, the partners, and the leadership of the East African Children's Project, the Board of Trustees. Thank you very much. Thank you. We really appreciate, and we really appreciate. God bless you. Stay well.